Quality Improvement Initiative, Improving Compliance of Antibiotic Stewardship in the Outpatient Setting, presented by Shauna Berg, Innovative Leadership and Collaboration in Healthcare. The organization's mission statement: to provide a continuum of quality healthcare services within current capabilities, to serve as a leader in a collaborative effort with the community, to provide health education and support services in order to care for all citizens. Organizational core values: customers come first. Education is encouraged and supported. Integrity shall never be compromised. Improving quality is the focus. Relationships with one another are founded on mutual respect. The foundation of everything we do is caring for people. Keeping the mission of the organization visible is critical to sustaining a culture-centered care of patients and families. By keeping ourselves focused on the mission of providing excellent patient services, our patients' experiences will become a testament to why we come to work every day and care for the patients and their families. The Quality Improvement Initiative will focus on improving compliance of antibiotic stewardship in the outpatient setting. Effective antimicrobial stewardship programs require a multidisciplinary team that will be responsible for promoting prudent antibiotic usage. An infectious disease specialist will lead the Antimicrobial Stewardship Committee. The committee members will comprise of the following departments: infectious disease, medical staff members, infectious prevention, clinical pharmacist, microbiology specialist, case management, data analytics, and quality department. The 4 core team members of the Antibiotic Stewardship Committee will be the infectious disease specialist, pharmacist, healthcare provider, and quality improvement. The core members will determine how the organization will need to address specific areas of compliance, what improvements can be achieved, how to implement and sustain organizational improvements. The meetings will be conducted with a problem-solving structure. The core team members will meet for approximately 30 minutes 1 week before the monthly meeting to plan topics. Monthly committee meetings will be held at the main hospital campus in a designated classroom and will last approximately 1 hour. The problem to be addressed is the high rate of antibiotic prescriptions written by medical providers for the patients in the outpatient clinic. Currently, a provider may not follow clinical guidelines when prescribing antibiotic therapy. Inappropriate antibiotic prescribing is a well-documented health concern and is a particular problem in the outpatient setting. The overprescribing of antibiotics is associated with increased antibiotic resistance, cost, and adverse side effects. Despite published clinical guidelines and decades of efforts to change prescribing habits and patterns, antibiotic overuse still exists. One solution to increase provider compliance with an antibiotic stewardship is through an educational intervention. Education can be the cornerstone of antibiotic stewardship process. The goal of education concerning antibiotic stewardship is to guide the provider as to when an antibiotic is indicated. The purpose of implementing an educational intervention is to increase provider awareness concerning the overuse of antibiotics, which may lead to a decrease in the number of antibiotics being prescribed in the outpatient setting. The creation of an organizational policy. The purpose of the policy is to optimize clinical outcomes by using evidence-based guidelines related to high-quality, responsible care that fosters a culture of appropriate utilization of antibiotics. The Antimicrobial Stewardship Program is responsible for optimizing antimicrobial utilization throughout the outpatient clinics. A program is designed to promote the appropriate use of antibiotics by selecting appropriate drug, dosing, duration, and routes of administration to optimize clinical outcomes while minimizing the unintended consequences of antibiotic usage. The Plan, Do, Study Act. The Quality Improvement Initiative will be presented as an evidence-based education module for all outpatient healthcare providers concerning antibiotic usage and stewardship for improved compliance. Steps taken to implement the Quality Improvement Initiative. Provider-specific data will be collected concerning antibiotic prescribing habits, including the drug, dosage, duration from patients' charts 1 week before and after the educational module initiative is implemented. The electronic educational PowerPoint module will provide information on the most current evidence-based antibiotic prescribing guidelines. Providers will be given 1 week to complete the educational module. After the educational module has been completed, patient chart data concerning antibiotic prescribing habits of the providers will be collected again for comparison. The providers will receive data from the organization's Antibiotic Stewardship Committee concerning antibiotic prescribing practices, including the drug, dosage, and duration used. An electronic health record software program, EPIC, along with the help of a data abstractor from the staff and the educational department, will be the only physical resources needed for this quality improvement initiative. No cost will occur to the organization to implement the educational provider intervention to improve antibiotic stewardship. The educational staff will help with the development of the educational electronic module. Potential savings. Antibiotic resistance costs the nation more than $2 billion annually. Besides the direct cost of antibiotic-resistant infections, there's also the additional cost of inconvenience of unwanted side effects for the patient, such as an allergic reaction that can occur. Impact of the initiative. Patient demand and the perceived perception that antibiotics is a cure for most illness is a contributing factor of inappropriate prescribing of antimicrobials. Top reasons given by providers for the unjust use of antibiotics in the outpatient setting is due to pressure from the patient and their families, as well as pressure from the organizational stakeholders to ensure positive customer satisfaction scores. Stakeholders are the catalyst for transforming the entire organizations and making meaningful improvements to the public's health. Doing the right thing by not prescribing antibiotics is essential and can minimize unintended consequences of antimicrobials in the population served. Therefore, stakeholders must have a buy-in in the quality improvement initiative, as patient satisfaction scores could be effective. Generating performance data. The clinical manager of the outpatient clinical site will be assigned as the data abstractor, who is responsible for collecting the data on both the provider's antibiotic prescribing habits as well as the patients who receive antibiotic prescriptions. The organization administration will support the implementation of this improvement. As a continuous goal of accreditation, the organization must be committed to improvement. The Joint Commission published new guidelines effective January 1, 2020 concerning new antimicrobial stewardship requirements for all ambulatory healthcare organizations that routinely prescribe antimicrobial medications. These new guidelines affect organizations that provide outpatient medical services, which include urgent care and immediate care centers. Outpatient providers will be required to participate in the educational module concerning antibiotic stewardship to keep Joint Commission accreditation. The expected outcomes of the educational module concerning antibiotic overuse will reduce the total amount of antibiotics prescribed to patients by 10% in the outpatient setting. A patient chart audit will be conducted through the electronic medical record system to measure if the 10% reduction was successful. The number of patients receiving antibiotics before the educational intervention will be measured through a chart audit to compare data to the number of patients receiving antibiotics after the provider educational intervention. Communication. Both quantitative and qualitative methods will be used to communicate with providers and administration. A quantitative measuring tool used for communication will be an email tracking tool. This tool will allow the sender to track how many people have opened, clicked through, or deleted emails. The qualitative method used for communication will be through a group discussion forum for both administration and the healthcare provider. The group forum will allow those who have access to discuss problems or issues openly and encourage suggestions for solutions. Most communication and updates with medical staff members and administration concerning the improvement of antibiotic stewardship will be through an exchange of emails. The monthly committee meetings will be held face-to-face in either a classroom setting or through a computer program such as Skype or Zoom. Educational opportunities. Other training and learning opportunities. One of the tools available to healthcare practitioners is an antibiogram. However, it is unclear if providers use this tool in their clinical practice setting. An antibiogram is the overall profile of antimicrobial susceptibility testing and is an essential part of clinical practice concerning prescribing the correct antibiotics. A community drug susceptibility report, the antibiogram, will be sent via email to the outpatient providers monthly. Improved provider skill in the use of an antibiogram will allow the patient to receive the best empiric antibiotic therapy when indicated. The educational module will increase the provider's knowledge concerning antibiotic usage and stewardship. The providers will receive data from the organization's Antibiotic Stewardship Committee concerning antibiotic usage, which will include the correct drug, dosage, and duration given to patients in the outpatient setting. Every provider will be assigned a number that is only known to the data abstractor and the outpatient clinical provider. Providers will be sent an email monthly concerning prescribing data to compare themselves to other providers while having the ability to remain anonymous. Having the ability to compare providers' prescribing habits may lead to improved compliance with antibiotic stewardship. A survey will be used to find out the opinions of those who participated in the educational module, which can determine how satisfied the providers were with the training they received. Getting feedback from the participants is the best way to continuously improve the organization, structure, and content of the training program. Here are my references used for this slide presentation.